Hi guys, today we're going to talk about postpartum sexuality. The postpartum period begins from birth of the child to approximately 6 weeks after delivery. During this important period, women will experience changes in physiology, psychology, and social aspects of their lives. This period will significantly change a woman's sexuality short term and long term. The circles of sexuality represent the complex components of sexuality. The concept of sexuality consists of intimacy, sexual identity, reproduction, sexual health, and sexualization. The postpartum period affects sexuality in such a way that all aspects are changed or require adaptation for women to adapt to their new sense of sexuality. Reproduction and sexual health. The most widely studied aspects of the postpartum period and sexuality are the physical changes from the delivery and their effect on sexuality. On average, physical intercourse penetration can be safely practiced after 4 to 8 weeks postpartum, depending on the type of delivery and physical trauma. This appears to be a common concern expressed by couples having their first child, such as implication of birth, methodology on intercourse, sexual activity, etc., and when this can be performed. So, physical aspects that may delay intercourse in couples. Genital tract trauma may delay sexual intercourse. Fear of lack of bladder control from women. Breastfeeding and hormones. Breastfeeding decreases a woman's estrogen significantly, resulting in a possible decrease in libido, decreased vaginal lubrication, and increased pain and discomfort during intercourse. Hormonal psychological changes. Although there are physical aspects that may delay coitus and may influence a couple's sexuality, other factors may play a key role in rediscovering and adapting to the postpartum changes in sexuality. So, postpartum depression is one of these factors. Hormonal changes and imbalances in women within the first 4 weeks after delivery are normal and emotional changes are expected. These are called the baby blues. However, women may be more susceptible during this time for major depression with an onset within 6 months after delivery. Postpartum depression may play a role in a woman's reduced sexual interest, sexual satisfaction, and frequency of intercourse. Postpartum depression not only influences sexual health, but it greatly influences intimacy, sexual identity, and sensuality. So body image is also really important because it's a women's body image is a psychological representation of her attitudes and self-perception of her appearance, and it can be significantly affected by rapid changes during pregnancy and postpartum. Body image is part of sensuality circle in sexuality. Women may experience body dissatisfaction during postpartum period due to narrow social constructions of beauty within the Western world. During pregnancy, women's standards of beauty shift as they are responsible for a new life, which provides them with new meaning. Increased frustration and body dissatisfaction is experienced by many women postpartum due to society's false expectations to fit into the standards of beauty quickly after birth. Body image dissatisfaction may also range from the struggle of a woman's acceptance of their body and refining their sense of self after birth. Other important factors the birth experience, social support, a woman's sense of her partner's sexual fulfillment, perception of her partner's sexual desire, and support postpartum are factors that greatly influence a woman's sensuality, intimacy experience postpartum, and in turn may affect all other aspects of sexuality. So, fatigue has also been researched and found to interfere with sexual activity and desire. New roles for women, such as adjusting to the role of being a mother. These will all affect sexuality postpartum. Trauma-informed care and social justice. So in the United States, postpartum intimate violence ranges for 4 to 7% prevalence. Pregnant and postpartum women may be at greater risk for severe violence if suffering domestic violence prior to pregnancy. Due to the intimate violence, women are automatically at greater risk of depression, post-traumatic stress, and an increased risk for alcohol and other drugs, and even death. In a relationship with intimate partner violence, the abuser may feel a greater loss of control due to the woman's new role of caregiver and may experience increased jealousy, especially towards the child. Trauma-informed care is important in order to provide battered women with assistance, safety, and support, and to empower them during such a fragile time as a postpartum period. Social workers should address practical issues such as safety first, followed by emotional support. Researchers should show that educating couples and women about what to expect after delivery may ease the return to a healthy sense of sexuality and self, and may better couples' experiences post-delivery. Thank you.